Good morning, everyone, and thank you for joining us today. I'm Dr. Velasquez, Health Officer for Spokane County. And today I'm joined by one of our team members, Karen Finkel, who is the coordinator for our ABCD program. And you're probably wondering why we're doing that today. And the reason why we're doing that today is because February is National Children's Dental Health Month, in addition to being Valentine's. Happy belated Valentine's to all. So, Karen, thank you for joining us today.
Yes, thank
And
you.
I think when we talk about oral health in children particularly, a lot of people go like, well, I'm not sure, but why is that? And go like, well, cavities are number one illness or condition in children, and oral health is very important not only from a physical, mental, and developmental health. So tell us a little bit, why is that a big deal for us?
So it's really essential to our overall health. If you have dental care, that can prevent the infections. It can also prevent the pain that is
Right.
associated with cavities. It makes it hard for children to eat, sleep, function if they're in pain. It's also essential for their nutrition and growth. If they're not able to eat correctly, they're not going to grow correctly and develop correctly. It impacts their speech. Also, it's really important for their long-term health. Poor dental habits are linked to future issues like heart disease and diabetes.
Right. So if that wasn't important enough, it should be. So let's talk a little bit about one of the questions I hear from people is, okay, so when do we need to start with the dentist for a
Yes.
child?
Yes, great question for caregivers. They should be starting, we recommend, first tooth or by their first birthday. If you see a dentist early, if you go into their office, even when they're sitting on mom's lap, the moms can hold them this way, they can sit on their knee and bounce them while they're looking, and the dentist is in there just examining their mouth. It makes them comfortable with that environment, so they're not afraid as they get older. Also, they can detect early signs of tooth decay, so that's always helpful. The earlier you get that, you can prevent it actually becoming a cavity.
Right, and that's very important for us to do. And by the way, I do know many of our pediatric dentists, and they're great at what they do, but they also have really fun offices. So it's,
Yes.
it's great to go.
Yes.
It's actually a great experience for
It
the children.
is.
So they do a good job with that.
Yes.
Just a plug for our friends out there. So let's go back to the family. So if you were going to talk to a family member, what will you tell them about this is the best way for you to help your children's oral health as they grow?
Yeah, so we have some great tips. One of the best things you can do is model. So when you're brushing your teeth twice a day and the children see you doing that, 2 minutes is what they recommend when you brush. We have these great little things, so that's another thing. We have fun things. Make it fun for them. This is a timer. It's 2 minutes. The kids can have their own control, their power, by turning it over, like, oh, here we go. And then it takes it off the caregivers as well. They can say, am I done? And you can say, nope, the sand's
You
not
still
done.
have
You got to
some,
wait
yeah.
for the sand. So that's something that's really helpful, making it fun with fun, colorful toothbrushes. These are really great because it's good size for their little hands. We give this stuff out at our outreach when we're talking to parents because it's really important that you make those times fun. You can use reward charts with stickers, sing songs, just anything to make it fun. That's really important. These little mouth swipes are great when they're infants. You can just rub along their gums, and it gets them used to that feel of
Right.
having something in their mouth and getting their teeth clean.
Well, having 3 grandchildren from 6 months to 5 years, I've seen all of those.
Yes.
I've seen them in use too, so, which is
Yes.
good. It is important for parents, caregivers to be aware of that, because the earlier you show the children what to do and how to do it,
Yeah,
then they'll continue doing it on their own very well.
absolutely.
So tell us a little bit about your program, the ABCD program, and what do we do, how do we help families? Tell us a little bit about that.
Yeah, so the ABCD program, it stands for Access for Baby and Children Dentistry. And that program, a little fun fact, it was started right here in Spokane in 1995, and now it includes 25 programs across the state.
Oh, wow.
Also, so just so you're aware, the requirements, children, it's from birth to 6 years old are
Okay.
what children are included. They need to live in Washington State and be enrolled in Medicaid Apple Health.
Okay.
In 2022, the program expanded to include children up to the age of 12 who are part of the developmental disability community.
Okay.
So they get those services a little longer. We try to connect families with certified dental providers, so
Okay.
they've gone through training that teaches them all the tricks and things that they need to know. We provide a list of 44 certified providers here at the health district. Those providers are broken down by zip code, so that makes it
Okay.
helpful to the family so they can find a provider that's close to them, easy to get to, so they're able to make it to their appointments. We also try to educate the caregivers. We go out in the community and do outreach. We take little goodie bags that we can hand out to families that might need a toothbrush or something that will help their child get into that routine.
Wonderful. So I'm glad you mentioned the 44 providers by zip code, because sometimes people say, well, I don't know who's near me, and
Yeah.
for me to go over there is too difficult. So let's make sure we don't make distance an issue or a concern.
It's important.
And if I'm a family member and I want to access the services or the ABCD program, how do I do that?
So you can go to our website right here, srhd.org, and go to the ABCD program. On that website, you're going to find the dental list and also brochures, flyers with all the information you might need. You can also call. I am the ABCD coordinator, so you can call me. That number is 509-324-1651. I can connect you with that list. I can email it, I can mail it, or even just go through the providers with you. So those are the best ways to get a hold of us.
Got it. So sounds like it should be pretty easy for anyone. And now everybody knows the face behind the number in the program, so okay. That was a
That's
close up. So I think we've given people a lot of information, and I'm glad you highlighted the long-term potential issues of oral health when you're little, and it starts as soon as you start to see
Yes.
teeth, actually before that. And the sooner we start, the better off we're going to be. One of the areas that I've heard kids sometimes is, I don't like to smile because I don't like to show my teeth,
Yes.
which from social development
Yes.
is very impactful if they feel shy about their presence.
Yes.
So maybe not the number one item on anyone's list, but it's something that we don't want to forget, which is that feeling of wellness, like I'm okay,
Yes.
so I can
It's
smile.
really
So also,
important.
okay. So anything you want to share with the community that we haven't mentioned yet?
Well, I think that when we talk about nutrition, those kind of things, sugary snacks, those gummy snacks, really get caught into those teeth. That can be hard for especially little hands trying to get those out. It's really important. Children should be helped by their caregivers until about the age of 8.
Okay.
It's really hard for them to do that by themselves until that age. But they can still practice. You can, like, at a certain age, let them start practicing when they're ready, let them do a little bit, but then finish up for them to make sure to get all that extra stuff out. But offering them sugary drinks are really hard on your teeth. That just sits there while they're out playing and stuff. So try to offer water. You can even add fruit to that water to make it more appeasable to the kids. So things like that. Just knowing what to feed them, how to help them clean them really well, and parents, getting into that routine is going to be the most helpful.
Wonderful. I'm glad you mentioned water. The power of water
Yes.
for hydration purposes is actually the best thing to hydrate with naturally.
Yes.
So let's make sure we drink as much water as we can.
Absolutely.
And I just want to say thank you to Karen for joining us today. Thank you to the team here and folks that participate in the ABCD program, our providers and others, because together we're ensuring that our children, youth and young adults, I'm going like that, grow up with not only beautiful smiles, but healthy mouths in a way that protects their health, their well-being, and their wellness as they grow into adults. So
Yes,
thank you very
so
much for
important.
joining us.
Thank
and
you. Thank you for having me.
Everybody, share the information with your friends, family, and colleagues. And don't forget, you can reach Karen at the number she provided, or go to our website and click on the Access to Baby and Child Dentistry Program. I'm reading from the screen because I can never remember what the ABCD stands for.
Yes.
Have a great day, everybody. We'll see you again next week, and stay safe and stay well. Thank you.
Thank you.